the host or the co-host or the panelist, but select everyone so that everybody gets to hear your great ideas and thoughts and questions. And that reminds me, if you do have questions, please ask them in the chat because we will mine them at the end and maybe during and pull them up and try to respond. So after this webinar, when you close out, even if you leave early, you're going to automatically be directed to an external site. Don't be afraid. It's not some spam thing. Go to the external site and complete the 10 question evaluation form. From there, it's going to send you to another survey, which is like 4 questions to dive a little deeper, just to help us assess that we're actually increasing your knowledge and that we're meeting your needs. And then you're going to be able to download the certificate of attendance that you can customize. I know everybody wants to make sure they get that certificate. And as I said, this webinar is going to be available in 2 to 3 days on our YouTube page. So the TTC network, well, what is it? There are 3 TTC networks. There's the Addiction Technology Transfer Center, Mental Health, and the Prevention Technology Transfer Center. And each one of these has 10 centers across the US. So if you're not in the Southeast here, you're in a region that has an ATTC, MHTTC, and PTTC. And they all have a coordinating office, and they also have special population centers, such as the National American Indian and Alaska Native Center and the National Hispanic and Latino Center. And basically, these 3 centers that are funded by SAMHSA are all about helping you do your job, providing you free resources, free trainings, and free technical assistance. So do check them out. So we are with the Prevention Technology Transfer Center, and here's a really nice map of all of the 10 regions. And you see we are, if you click one more time, Carlton, of course, we are here serving 8 states of the Southeast, and those are the states. We are housed at Wake Forest School of Medicine in Winston-Salem, North Carolina, and we are under the direction of Doctors Kimberly Wagner and Mark Wolfson. Okay, so the PTTC network really believes in the power of using inclusive language. It's the recognition that words matter, and word choice can be used intentionally or unintentionally to include or exclude others. Using inclusive language communicates in a way that is respectful and brings everyone into the conversation. So this is a 3-part series. The first one today is planning and evaluation. On August 2nd, make sure you've registered for the one about principles of the environmental approach for the prevention professional. And then there's the 3rd session, which is in September, which it's going to be here before we know it, which I can't believe. But I'm really excited that we're going to have this one on youth engagement in the education sector. And it's about increasing youth social justice awareness through the schools. So it's a really timely one, and I really encourage all of you to register for that. So now I'm going to invite my co-coordinator, Taylor, to introduce our 3 esteemed speakers today.
Thank you, Kristen. So we have 3 speakers today that I have the opportunity to introduce. So our first one is Carlton Hall, and Carlton is the president and CEO of Carlton Hall Consulting, LLC. Carlton has been providing intensive substance abuse misuse prevention and community problem-solving services to the nation for the last 25 years. And currently, Carlton and the Carlton Hall Consulting team provide executive training and technical assistance support to the Southeast PTTC Region 4, which is what Kristen showed you earlier. Our second speaker is Endurance Science, an organization committed to supporting coalitions, agencies, and individuals to improve the health of their communities and the environments in which they live. Dorothy has also served on many state-level work groups and advisory committees in Wisconsin. And for more than 20 years, Dorothy has worked with community-based coalitions to address the impact of substance use on youth and families. And last but certainly not least is Dave Chevelle. Dave Chevelle has extensive experience in the substance abuse prevention field at the community, state, and federal levels as a community organizer, coalition director, trainer, and technical assistance provider, researcher, and state prevention manager. Dave currently works throughout the U.S. and internationally to provide training and technical assistance to increase the knowledge, capacity, and accountability of community anti-drug coalitions. And with that, I am going to turn it over to Carlton.
Taylor, thank you so very, very much for that introduction. Kristen, thank you for setting us up, and thank you all for joining us. We're looking forward to having a meaningful conversation with you all around planning and evaluation, and how we might be able to kind of raise the level of our state of play, if you will, as prevention professionals. I am honored to have my colleagues and my friends to be able to walk with you through this conversation. We've worked very, very diligently to try to make sure that we were able to craft a conversation that would allow all of us to learn with and from each other today, as we are going to explore tools and resources and ideas and concepts that will allow us to know how we might be able to do what it is that we do a little bit better. But we can't do any of this without fully getting to understand who we are going to be working with. And so, as Kristen mentioned, we're going to be engaging you all a lot in the chat room, right? And you're going to get out of this training as much as you pour into this training. And so we're hoping that you'll just kind of get in the chat box and play with us today, because that's what it is that we're really looking forward to. So if you don't mind, let's start off. If you wouldn't mind putting in your name and what community you actually represent, organization, if you wouldn't mind, and what you might love about planning and evaluation, just as an idea as we get started today. Go ahead and start and begin to do that, and know that we're going to be interacting with you and engaging with you throughout the session and the training today. But I want to prompt you all with a bit of a question after I thank our partners in helping us to be able to do this. Of course, the Substance Abuse Mental Health Services Administration, which supports all the TTCs throughout the nation, as Kristen mentioned. But I particularly want to thank my colleagues and partners at the Southeast PTTC, and in particular, Dr. Kim Wagner, Dr. Mark Wolfson, Kristen Kidd, and Taylor and Olivia, and all of the crew that really helped to make sure that this is possible. It is our honor to be a partner with you in bringing this series to you all. Why? Because this is a priority, as Kristen mentioned, for the Southeast section to build the level of our capabilities around what it is that we do. So I want to start off with a couple of questions that I wanted to pose to you. Why is it that we plan, and why evaluate? Why plan? Why evaluate? And go ahead and in the chat begin to put some of your thoughts around that. Why plan? Why evaluate? Why is this important? Why did you deem it important enough for you to give up a couple of hours of your time? And I'm really happy we made this designed this webinar to be just a slightly bit longer than our typical kind of 60 or 90-minute one, to allow us with a little bit of opportunity. I'm seeing some really great ideas presenting themselves, Dave and Dorothy. I'm seeing readiness. I'm seeing a lot of folks kind of putting in their thoughts about why we plan and why we evaluate. Are you seeing anything, Dave?
Well, I'm seeing just one thing I'm seeing, we have, it looks like 20 different states and territories represented. So there are lots of different views. And basically, I love the last one, to be prepared and to be effective. That's as good as any. Thank you, Andrea.
Extraordinary. Thank you, Andrea. And if I can offer just a couple of thoughts as we move into this, and we're going to engage a great deal, but I want to start off with a little bit of an activity, a little bit of a game, if you wouldn't mind. And please work with me, because I promise you there will be a point to this. If we're looking at this picture, and if this picture was an actual picture of an actual shirt, I'm going to ask you the question: how many holes are you seeing in this shirt? How many holes are you seeing? And I want you to put in the chat box how many holes you're seeing. And I'm only going to give 15 seconds about this, 15 seconds. And Dave and Dorothy, when you see them populate, how many holes do you see? 15 seconds, 15 seconds.
You see 10, 8, 6, 8, 6, 2.
2.
Got it. Okay. You can stop now. But what I don't know if we're all looking at the exact same shirt or not, but if we are, I will tell you that the actual answer, is a number of you have put in, is actually 8. You're exactly right. And how do we count this? So there is a hole right here, if this was an actual shirt, for our neck to go through, of course, right? And a hole right down here for our body to go through. So that's 2. You have 2 more for the arms, so that's 4. And if this was an actual shirt, what we're actually seeing here is a hole in the front and a hole in the back. And so that's 2 more, and another hole in the front and hole in the back. And that's another 2 more. And that's a total of 8. And so, yes, the answer is 8 if you ever see this again. But why did I do this? What's the point of all this? Well, I would offer one thought about this. There is a saying in the community that I was brought up in that says that, you know what, you can't really truly solve a problem until you can first see that problem properly, right? And I liken that to what it is that we are actually talking about. Excuse me one second. Goodness. Hold on. Give me 1 second, guys. Give me 1 second. Gosh.
Are you having problems with the slides, Carlton?
I am.
Is it
I
not
am.
advancing for you?
I think something happened with the annotate that I wasn't prepared for. And forgive me. I just want to
See what it does now.
I'm going to stop sharing my slides. Forgive me. I'm going to come back. I'm going to begin this again. Just 1 second. All right. You guys are seeing my slides?
Yes.
Okay, good deal. The point that I wanted to try to make is the fact that, in a very, very real sense, for those of us that are professionals in this field of prevention, we are coming across opportunities that are provided to us by either our federal funders or our state funders or our local funders, like those that are represented from the Department of Justice, and those that are represented by those of you who are drug-free community grantees, for example, or even those of you who are strategic prevention frameworks, partnerships for success, PFS coalition grantees. Each of these are representative of opportunities to utilize prevention science so that we might be able to help our communities see properly, understand how we might be able to think appropriately, utilizing and applying the tools of prevention science to be able to do so. And so I just simply wanted to start off with a quick activity to be able to help us to engage in that way, because this is exactly what this session is going to be about. We're going to help us to think properly, see properly, by understanding how we might be able to describe planning and evaluation in a way that addresses the strategic prevention framework. We're going to look at important tools such as SMART objectives and how that guides our planning work. We're going to explore those tools and how we might be able to consider those tools, particularly through a framework or a filtering of health equity considerations that we might be able to understand. And we're going to go through all of that by looking at how we might be able to achieve the goal of population level change and doing all that, all the while listening and learning with and from each other. And so here is our agenda that we have. It's going to be a tight agenda. We have a lot that we're going to get through and get to on today. We're going to provide opportunities for you to have conversations with each other. We're asking those of you, when we get into the breakout sessions, you are all professionals, you are all leaders here, engage with each other, listening to each other, learn from each other, take those set opportunities well, and we're going to be able to benefit from all of that. And so with that, I'm going to gratefully stop sharing my screen right now and allow my wonderful partner partners in this endeavor take us the next step forward. And I believe, Dorothy, you're up first to be able to help us to move on in this conversation. And so with that, Dorothy, the baton is yours.
Well, you had a 50-50 chance, Carlton, and it's me that's going to start.
Did I mess up?
The role of Dorothy will be played by Dave Chevelle for the next
Yeah,
section.
so okay.
Yeah.
Dorothy's the one with the shades in the back.
Yeah.
Welcome, everybody. And it's great that we have people. I counted 16 different states and territories represented. And it looks like we've got 65 people total, which means we know who won our poll going into this. But it's great that you're here, and it's great that you're using the chat box, because as Carlton has said, that it is important that we have an interaction with the participants as best we can. So what we want to do at first, as Carlton shared in the agenda, is really set up why we plan. Then Dorothy will come back and lead us into the planning piece. So the first question we asked, why planning and evaluation? But a great way to look at it is, many of you have heard the river story of prevention, and we stole this picture from Wisconsin. I noticed there are a couple of folks from Wisconsin on this call. But when you think about it, prevention is, the story is, if you look on the lower left, the left-hand side of this, you'll see some people downstream in the river, and they've fallen in and they need some help. And so what we can do is we can jump in the river and we can save them. We can put nets downstream the river so that when people fall in, we can save them. But if we're good preventionists, what do we want to do? Dorothy, what do we want to do if we're good preventionists? I can make you unmute yourself here.
We want to look both downstream, but we also want to look way upstream as well.
Exactly. We want to walk upstream and find out why people are falling into the river in the first place, and look at those conditions and say, okay, when we do walk up, we see there's a bridge and the bridge is out, and people are falling into the river from this broken bridge. So we want to fix the bridge. We're going to talk about environmental strategies. We also want to teach them individual strategies to navigate a broken bridge, or if they fall in the water, to teach people to learn to swim so they can swim to the shore. The whole point is we want to be intentional about doing work in planning and evaluation. When we do that, we can be intentional and we can be proactive and try to start problems before people and keep the number of people that fall downstream to as small as possible by addressing the problems upstream, the risk factors, the root causes upstream. So it's really, planning allows us to be intentional and proactive in our work in prevention. And so again, the process, that there are many different processes out here. Many of us are familiar with the strategic prevention framework. What we are focusing on today is planning and implementation and evaluation, but you can't do that without the assessment. We're going to make the case that the assessment is what drives our ability to do the planning, to do the implementation and evaluation. And so we're using this model. There's lots of different models, and I would suggest that every model that we look at has some form of assessment, planning, and evaluation in it. So to just look at what the SPF looks like to provide the orientation for us here, we start with an assessment. So we may have done an assessment. We find out that retailers are selling alcohol to minors. So 25% of our 10th graders report 1/4 say they can get alcohol from retailers. We have lots of failing of compliance checks. Well, if we know that, then we can do our planning, and we can look at strategies to put in place to train the retailers, educate the public about the issue, require RBST, responsible beverage server training. When we do those strategies, then we can look at our implementation and evaluation and say, did we see the number of compliance checks decrease, failed compliance checks decrease? Did we see the number of youth who are reporting they can get alcohol decrease? So the SPIF, the Strategic Prevention Framework, allows us to go through this process of looking at an issue, what is the assessment, to identify our plans, implement them, and then evaluate, did we make a difference? And so this is what we're going to be covering throughout the training today. And I'll say, Carlton, Dorothy, anything you want to add to this overview of, again, setting up the planning and evaluation that we're covering?
No, sir, you covered it.
Okay, great. So I'm going to ask this. If you notice, we have a blank screen here. What are the benefits? We talked about why we do it, but what are the benefits to do planning and evaluation? If you could put in the chat box, use your chance. Why do we, this is related to why, but what are the benefits if we do an effective assessment, planning, and evaluation? How will our communities benefit? Thank you, Kristen, for putting that. What are the benefits of planning and evaluation? Better outcomes. We can have better results, better decreases in underage drug use. To see if a strategy is not working. So it's not only the big picture, we can look at specific strategies to know our results, to see if we're being impactful. And I love that, Anastasia, across the whole community we want to look at. If we're using funds, we want to make sure we're accountable to our funders. I love it. To grow and improve, we always want to improve and expand our impact. If it works somewhere else, we know we may need to make some adaptations. We're going to talk about it, but we can apply the similar strategies to address similar conditions. Knowledge of where we are, we prioritize. There's lots of issues in our community. I love it. You all get this. We have a very informed group here that understand why we do it. And so this is exactly what we wanted to do to set up our first breakout session. And we all know, again, what planning and evaluation is in the big picture. We know what the benefits are. And some of you may have had experience with planning and evaluation. We want to, if we can, I'll say customize this training as much as we can by giving you a 10-minute breakout. And in these breakout groups, there's going to be 5 or so of you in each group. And just quickly, you'll have 10 minutes. If you can quickly introduce each other and then just discuss what questions do you have about planning and evaluation, or if you've experienced some specific challenges in doing planning and evaluation. And this may or may not be related to substance use prevention. But what we would like to do when we come back, there's going to be a lot of groups. We have what we can ask you to put your challenges or questions in the chat box. That'll serve as a guide for Carlton, Dorothy, and I to make sure we meet your needs in going through this training. Anybody want to add anything in terms of instructions before we go to the breakouts? You're going to have a 10-minute breakout. You'll get a 1-minute warning before the end, and then you'll come back and share your conversations in the chat box.
So challenges, Rose, funding barriers, community support, and participation. Data being skewed, that's a really good one. So funding barriers.
Participation. Dorothy, one thing that I love about the strategic prevention framework, I hear several people are putting participation, is that as you walk through each of the elements, there's always an opportunity to identify and engage new people in the process. When you do your assessment, you start with identifying people who may have data, or you start doing listening sessions and focus groups. There you can start to identify people to not only have the focus group, but then say, hey, can we involve you later on when we get involved in planning and implementation and evaluation? Then when we get into the planning, we can invite more people. So there's always an opportunity to be inviting and engage more people into the process.
I love that. You know, the strategic prevention framework is really a community participatory process as we start to implement it, which is really what you're describing. And I love that. Lorianne, I really like that comment. You started putting your local data next to state and national, and it's a great way to get more confidence in data. It's also a really great way to start telling the story of what's happening in your community by giving those comparisons. Local politics and state politics. Yeah, the work that we're doing has, a big P politics and a small p politic community element, doesn't it? So yes, we're always navigating both formal politics and then the local community dynamics as we're working in planning and evaluation. Absolutely. Good comments, folks. Keep them coming.
Lorianne mentioned comparing your data to state and national.
You open up?
Other communities.
You open up?
That's a great way to assess if your data are skewed, because you can start to say if your data is way off from the state, then you can say, maybe question it, say, why is ours? Maybe you didn't have that many youth participate in the survey, or maybe something happened in the community. So I love that, Lorianne, being able to compare as a way to kind of assess the validity of your data.
Yeah, Lorianne said it often lines up. It does often line up, doesn't it? So we can see where we fit with the state levels, but also with the national levels. And what's also really important about doing those comparisons, Lorianne, is when it doesn't line up, we know that we either have a problem that's particular to our community, or our community has some sort of protective factor that's buffering us from the problem. So yeah, that comparison piece is really important for looking at skewing the data, as Dave said, for telling the story. And it tells us if we've got a positive story to tell because we're doing something right in our community. I love it. Rose says prevention is a very specific skill set, conducting needs assessment, logic models, program evaluation, and data analysis. Many people working in community organizations have to rely on outside sources for the science. Yeah, we are, as prevention professionals, the strategic prevention framework helps us embed that science into our work. I love it. Mindy says a big challenge that they have is getting data and implementation planning that reflects the needs of the entire community and across sectors. And I look forward to hearing more about that, Mindy. But yes, different sectors are going to look at the problem differently, aren't they? They're going to have different priorities and different needs. And part of our work in building capacity to address the problem is identifying how we can meet the needs of those different sectors, because law enforcement's needs are going to be different than parents, they're going to be different than youth. So different than maybe a migrant population, like in my community, that has a specific set of needs. Yes, yes.
And it goes back to that participation that we talked about. When you have representation from different sectors and across the diverse groups in the community, then you can start to identify what are the conditions that each group is experiencing. And
right.
Also, as Dorothy mentioned, what are the resources that can be applied to each of those conditions? I think what we're describing here is the benefits of a coalition as well. When we have people coming together, again, we can have that representation, which doesn't mean if you're an agency putting together a program, you can't go out and form a work group to inform you as you walk through this planning process. So whether you're a coalition or a service provider, you can still get that community input in the assessment, planning, and implementation phases.
Rose says that capacity building and collaboration amongst key stakeholders is not always easy. And I'm just going to say simply to that, amen. It is a process that takes time, and it also requires us to bring other stakeholders to the table for them to also help us build those relationships. But it's a process. Community organizing and coalition building is an ongoing process. And absolutely, the one thing I'll say though, Rose, when we're looking through the lens of planning today, one of the things that Dave and I say probably a little too often, but it's true in this work, is people own what they create, a quote by Margaret Wheatley. And when we're thinking about collaboration and capacity building, it's often a really effective tool to bring people to the table to help plan, to have their input and their energy and their expertise involved in the planning process. That can help build your capacity and to increase your collaboration. Good comments, everyone. Dave and I have been writing down the challenges and the questions. Encourage any more comments or questions from any of the other folks that may be still with us.
Rose points out a good point about the strategic prevention framework, the capacity building aspect. And again, we always say that capacity, even though it has a separate circle, it should be in the middle as well, because you build capacity as you're building assessment, as you're doing your planning, as your implementation and evaluations. We're always building capacity.
So I went and joined a breakout so that I could unmute them, because we didn't realize a panelist had to be in the breakout. So a lot of people were stuck on mute, and I don't know if you discussed that, but some of the challenges that people talked about in my group is getting others on board for planning. And sometimes people feel like they need to do what the funder wants instead of what they really want. And then a really big one that came up is for evaluation is the challenge in timing. How long it takes to measure impact, that often you don't see the impacts of the work until they don't happen until the funding is already ended. So you're not able to measure that impact, and that can have repercussions for getting future funding and for keeping people engaged in the work.
All really, really important points. And we are going to speak to many of them as we go through the session as we get into the details and the content a little bit further. So that's fantastic.
And it looks like we have 62 attendees back. Are all the groups back?
Yes, they should be.
Okay, thank you.
Welcome back.
Well, just to debrief this, first of all, we apologize for the technical challenges. We have learned a lot about breakouts in WebEx. And so what we'd ask you to do now, those that were in your breakout rooms were able to have a conversation. If you could put some of your ideas in the chat box, we have been having a conversation with those who haven't been able to join the breakouts. But those of you that were in the breakout, if you did have a conversation, can you put some of your questions or challenges in the chat box? And while you're doing that, we'll just summarize what the conversation we've had in the main room. There's a discussion around data, how data are so important, but sometimes data can be a challenge, and collecting the data and making sure the data is valid. And Lorianne brought up the concept of when we look at data, let's look at comparisons with similar communities, with the county, with the state, with national data, to see if ours is in line. If it's not, we can try to understand why our data may be different. Is it a data collection issue, or is it a difference in our community? So data are important. And as we go through this, you will see how data is so important in identifying the changes that we want to achieve in our community. And another question that came up is the challenge in timing. How do we measure outcomes when we're not going to see changes in youth 30-day use of alcohol for 5 or 6 years? We're going to be talking about short, intermediate, and long-term changes and how we measure that. There's also a discussion around participation, how you build participation in this. And our conversation was around using the strategic prevention framework. We can build participation and build on it in each phase, starting with assessment. When we do a focus group or listening session, invite those, or a key informant interview, invite those people to say, not only thank you for sharing with us, would you like to be part of the planning, implementation, and evaluation effort?
Dave, I'm gonna share some comments. I don't know if you've had a chance to read them. I love what Anastasia just commented. She's looking for better ways to evaluate other than surveys, how to increase participation, and stakeholders that want to skip the important steps. Probably those doers who just want to jump into strategies rather than plan. Victoria said that one of the challenges that they have is bringing along the logic model as we go through the planning and evaluation of SPIF processes. I'm very excited for this session, Victoria, because we have an answer to that challenge. And Amanda says our current challenge is getting our coalition on the same page so we can begin planning. We also struggle with meeting the needs of our grant and balancing that with what the community needs.
And Dorothy, I want to just piggyback on that and just commend the folks that I was able to join in those breakout sessions, even though we were all experiencing the technical difficulties. Folks, these prevention professionals were going at it really in the chat with each other, trying to make it work. And so I want to thank them for being deliberate and intentional about the outcomes that they wanted to get out of this training. So thank you very, very much. We're going to make adjustments along the way, and we're going to get past that, and we're going to have an excellent training throughout. So back to you guys.
Okay, and this is great, and these will help us to customize what we say as we go through the rest of this training. And if we're not answering one of your questions, please feel free to type it in the chat box to make sure we answer it when we get to that part of the training. And speaking of getting into that part of the training, I'm going to, if I can do this, stop sharing and turn over to Dorothy, who's going to allow us to jump into what is planning.
Awesome. I'm really excited about this session, especially based on the comments that you folks just made. So before we can jump into our planning, we have to identify what it is that is our priority. Now, I want to just preface this by saying a couple of things. First of all, we're never just going to be working on one problem at a time, but we need to plan for one problem at a time. So we also want to make sure that we're adhering to the strategic prevention framework. So planning, as you see, is halfway through the process when we've already conducted our community assessment. So now we've got all this information. We know what's happening in our community, and we need to, establish some priorities. But can anybody tell me what Shrek said that ogres were like? And Dave, I'm going to ask you to watch the chat box for me, because while I have the slides up, I can't monitor the chat. So onions, Brooklyn, yes, they have layers. Ogres are like onions. And imagine
you
that
guys have found your crew. You guys have found your crew.
It never ceases to amaze me how many people know what Shrek said ogres were like. Yes, they are like onions. You need to peel back the layers. And so that's exactly what we're doing when we're doing problem prioritization. So our community assessment is sort of that, I always think of it as sort of our data warehouses, getting that information, making those comparisons, talking, identifying that information that is going to give you the story of what's happening in your community. So we know that there's probably going to be lots of problems. We know there's going to be lots of protective factors. There's going to be lots of great things happening. But we've got this needs assessment. We've identified the resources that we have and then the gaps in resources. And we may have also gauged our community readiness. So we've got all this information. So how do we then identify what's going to go into the logic model? Well, we need to do some problem prioritization. I often think about our problem prioritization. I think about it as an hourglass, and think about the top part of the hourglass as your community assessment. We've got all this information, and your logic model is going to help us drive into strategies and get wide again. That problem prioritization is that narrow part of the hourglass where we take the information, we prioritize it, and then we identify what our logic model and strategies are going to be. So we want to prioritize for our problem. We want to prioritize what those intervening variables are, peeling back the layers to find out if youth are using alcohol, why. And then we also want to identify and prioritize those community conditions, what those intervening variables look like as behaviors in the community. And from that, we have our logic model.
And Dorothy, that's that walking upstream, is to find out, again, why are youth falling into the river? What are the conditions? What does it look like in this community? Because Dorothy, when you've seen one community,
you've seen only one community.
Each community is unique, exactly.
I was thinking about that when I saw we've got someone on the call from Portage County, which is right next to my county where I live in Wisconsin. And I know underage drinking looks different in Wood County than it does in Portage County. Every community is unique. So let me just, in the chat box, I'm going to ask folks to, in your community, which would you prioritize for you to work on to address the drug problems for youth? Alcohol, marijuana, prescription drugs, tobacco or nicotine, methamphetamines, inhalants, over-the-counter drugs, or other? And if so, if you could connect with what that other is. So A, B, C, D, E, F, G, or H. And if you pick H, if you could tell us the substance, we're going to look at the chat box. Rose said A and B, A and B, B and D. For those of you who are selecting substances, can you tell me how you made those decisions? Why you're making, Rose, you've picked A and B, both alcohol and marijuana. Ashley picked alcohol and marijuana. Anybody want to tell me in the chat box why they picked those problems? How they know that those are a problem in their community? There's a vaping epidemic among youth. Vaping. So we see that. And we know that there have been overdoses. So Ashley's saying there's been overdoses. So we know there's a lot of vaping in middle school and high school. We have done our community assessment. We're using our data to drive those problems that we're identifying. That's it, based upon data and our community knowledge. All right. So in which community, thinking about underage drinking, which intervening variable would you prioritize? Availability, favorable youth attitudes, parental attitudes, norms, price, community norms. So Rebecca says that community norms. So other community norms, B and D. So favorable youth attitudes and community norms. So again, we're probably going to be using our data to identify what those intervening variables are that are leading to the problem that we identified in the earlier slide. So let's get a little bit more specific now. So in your community, which is the big, yes.
Dorothy, before you go into the next part of it, if you can go back to the intervening variable slide, I'm really interested in the fact that if folks really look at those intervening variables, many of you might have heard some of those referred to as something else. Some of you might recognize them as being called possibly risk factors, right? And so a lot of times we are hearing and seeing the terms intervening variables, risk factors, root causes are often utilized interchangeably. And I find that striking when you were going over that slide.
I love that. And the other thing that I'm going to say to that, Carlton, really good point, is we often hear, in fact, if I had a nickel for every time I heard this, there would be a Lamborghini parked in my driveway, that we often hear peer pressure. peer pressure. The reason youth are using is peer pressure. When I think about that as a peer pressure, I'm thinking about the intervening variable or risk factor of favorable youth attitudes.
Yes.
And so that's a really important point as we're starting to peel back the layers. We know that underage drinking is a problem in our community, but we want to know why is it because there's peer pressure, there's favorable youth attitudes? Is there because there's alcohol served at absolutely every event in the community that ever happens? Is it because we've got drink specials and no retailers are checking IDs? Those are the intervening variables, the risk factors or the root causes. Now, how do we know which one we're going to work on? Because our data is going to tell us in our community assessment. Love it.
Exactly.
Thank you, Carlton.
And one other point is some, if you will, logic models stop here and they say, okay, you want to address availability, and they have you select strategies. What we would suggest that even if your funder only has you stop here, to take it to the next level, to be able to say, what does availability look like? Are you getting it? And this is where you can go to the next slide if you want. I'm jumping in on your piece here, but we want to take these intervening variables and break them down to say, but why here? What does it look like here? Because availability in my community will maybe look like 2 or 3 different things, from parents, from older siblings, from retailers. In another community, it may be at festivals or at celebrations. So we really want to understand, and this is what this is about, is breaking down, peeling back the layers on the intervening variables.
So love it. So let's take a look in the chat box. So thinking about underage drinking in your community and thinking about availability, where are youth getting alcohol in your community? Are they getting it from retailers? Are parents providing it? Are youth asking strangers to buy alcohol for them? Are 20 older friends and near peers buying it? I'm seeing some things come in the chat box, retailers and parents. So we're seeing all of the above. So let me just stop there. That's exactly why we want to get to this local conditions, because guess what? All of the above are probably community conditions in our community. Guess what? Parents may be providing alcohol and retailers may be selling alcohol. But you know why it's important for us to get to those local community conditions is when we get to strategies and we want to plan, the strategies to address parents providing alcohol to youth are going to be different than the strategies that we're going to have to stop retailers to selling to minors. And so that's why we want to do this problem prioritization based on our data, is because we may have to address both parents providing and retailers, but those are going to be different sets of strategies. We want to align them so that we can line up the strategies and then evaluate our progress, which takes us to this, our logic model. So we want to identify our problem statement first of all, and in this example that we're going to be using, underage drinking in ABC County is a problem. We also want to then look at why. We're peeling back the layers. Well, in this community in ABC County, it's really available. But like Dave said, we don't want to stop there because we want to know how it's available. And in this community, we've prioritized that our local retail stores are selling alcohol to minors without checking ID. Now, I also want to say, when you said all of the above, or A, B, and D, or A, B, and C, we know there's going to be more than one community condition for each intervening variable. We want to plan for each community condition separately and distinctly. And that's an important point of why we want to lay it out into a logic model. And we want to make sure that as we're developing our logic model, we're pulling from that community assessment. So we see here that our baseline data, because your community assessment forms then the baseline data that you're going to use for your logic model. So here we see that 32% of 9th to 12th graders are reporting alcohol use in the last 30 days. We also see that 66% of them are reporting that alcohol is really easy to get. And we are prioritizing that community condition of retailers that are selling to minors because we see that 38% of retailers failed compliance checks in the last round of compliance checks. So you'll see how we prioritize those intervening variables, and then we also identified those specific, identifiable, actionable community conditions. It's all based on our community assessment, and now it's all lined up in a logic model.
And Dorothy, folks talked about, just to go back to that, the value of data and different types of data collection. And so we want to talk to people when you get to that local condition retailer selling to minors. Let's talk to retailers and see what they say. If there may be issues, let's talk to youth and find out what their view. Let's talk to parents. So for each of those community conditions, we want to really use multiple pieces of data, both quantitative and qualitative data, that really allows us to fully understand both the problem, intervening variables, and community conditions. That'll allow us to really target our strategies.
Love it. And there was also a comment about getting to evaluations that are more than surveys, and collecting data is more than surveys as well. Just like Dave identified both qualitative and quantitative. Here we also see that we've got law enforcement data as well. That is another great source of data to look at when you're conducting your community assessment. So here's an example of a logic model. This is one that Carlton and Dave and I just love. There are many different formats for logic models, many, many different formats. This one actually was developed in North Carolina, so within the Southeast region, and we love this format for so many reasons. So we're going to use it as an example today. But the very first piece of the logic model are the problem, the what, why, which is your intervening variable, and then why here, what that community condition looks like. So that's the very first part of the logic model, and we've now completed it. We've now used our problem prioritization process to prioritize the problem, the intervening variable, and the community condition. So with that, I am going to stop sharing my screen, and I'm going to turn it over to Dave to take us into the next piece.
I love transitions when they're smooth, and hopefully this is a smooth transition here.
You did it. You did it. You stuck the landing.
So where we are now, as we move into planning, we have our logic model that provides what is we want to change, and there may be multiple community conditions. Then what we want to do as we move into planning, identify what are our objectives. We have data that says X number of X percentage of youth are using. What do we want to see that change to? And this is where a lot of the comments were talking about community participation, whether we're with a coalition or a provider or an agency, we can get input on all these processes and all these steps to get people's perceptions on what are the problems, what are the priorities, but then also what are these objectives? What do we want to try to achieve both in the, and we're going to cover this, in the long, intermediate, and short term, and that's based on our logic model. So that tells us, the logic model tells us what we want to change. The SMART objectives tell us what we want to achieve. And then the third element of planning is what everybody thinks about in terms of planning, is what strategies and action plans will we put in place to achieve those objectives, to address those conditions we've identified in our logic model. So that allows us to jump into the actual planning piece. When we have our logic model, we've identified targets of change. We want to identify in the long term, we want to change that underage drinking. In the intermediate term, we want to change availability of alcohol. In the short term, we want to change retailers selling to minors. So another way of looking at this logic model, if you all play dominoes, there's two ways to play dominoes. One is the one where you have numbers and the numbers line up. The other is where you line them up and then you knock them over. So if you go from right to left here, if I do my hands right, if we address the community conditions, the retailer selling to minors, the older siblings providing alcohol, they're getting it at community events. If we address enough community conditions, and if we address enough intervening variables, we will ultimately impact the problem. Again, this goes back to those layers. Let's address those layers by walking upstream, finding out what are those conditions that will eventually lead in the long term to addressing intervening variables in the problem itself. And so what we focus on with our strategies, this is the point that Dorothy made, are those community conditions. So we develop a separate set of strategies for each community condition. As Dorothy said, retailers selling to minors will have a set of strategies. If parents are hosting graduation parties, and that's where the youth are getting their alcohol, or family celebrations. We heard in one case it was baby showers. And that community, that's where youth were obtaining their alcohol. Again, when you've seen one community, you've seen one community. We address each of these community conditions, each target of change, with a separate set of strategies. Here's just another example of a target of change looking at underage nicotine use. We see 26% of our students used electronic vaping products in the last 30 days. And we say only 56, and one of the reasons is, walking upstream, only 56 think there's any harm in using the vaping products. We're not smoking, is the response. There's no harm in it. And so what we see, even at the middle school level, youth are vaping in the bathrooms at middle school because they don't think they can get caught, because they don't think there's any harms in it. So if we were just to address vaping itself, we'd have a lot of strategies, but now we know youth are vaping at school. There's a lot of strategies we can put in place to target that community condition. So the whole point is to make sure that we have done the collection and engage the community sufficiently to be able to identify the problem, intervening variables, and community conditions.
I love this. This one of the things that I love about the fact about all of this is that it really underscores the fact that before we actually get into um, um, thinking about strategies at all, we have to have a good assessment and we have to prioritize. All of that is important, and we have to make sure that we have data for each of those sections. That's what sets all of this up to be able to do what you just kind of laid out for us, Dave. So very, very well, identifying those targets of change. You can't do any of that until we go through the prioritization process that Dorothy set us all up with first.
Then we can jump into our planning. And so planning involves when we have that logic model, when we have that target of change, then we can create those smart objectives. And we're going to cover what smart objectives are, which is what we want to achieve. And then after we do that, we'll be able to say, okay, what strategies do we need to put in place? And selecting strategies is based on identifying who the population is we want to address. What strategies do we know have been effective? There's evidence-based. We know that it takes a comprehensive set of strategies, and we want to make sure as we address those strategies that we do it with a health equity focus, meaning that we don't cause any harm or unintended consequences as we implement those strategies. Then when we have good strategies, then we can move into action planning. So this is going to be your life for the next 30 minutes or so as we walk through this part of planning. And so I'm going to just jump into the SMART objectives that really guide us to be able to say what strategies we want to put in place. And so when we talk about SMART objectives, anybody, I'll just offer to the chat box, anybody can tell me what any of the S, M, A, R, or T means. If you want to put in the chat box, I'll go through it. But again, specific means that we're addressing specific issues. When we write an objective, we want to know exactly what it is we're changing. And fortunately, when we have a logic model, we know we're changing the community conditions. We know we're changing the intervening variables. We know we're changing the problem. Measurable means that we can measure that change. And when we have data associated with each of those, it makes it real easy to measure both our baseline and then over time, whether that baseline has changed. Specific, measurable, realistic, time bound. Excellent. Thank you, Sherry. Achievable means, and this is where the community input come in. If right now 39% of our youth reporting that they're drinking, is it reasonable to expect that to go down to 5%? So again, to see a 34% increase, maybe not. Let's have the community involved in identifying what is an achievable change to the problem, intervening variable, and the community condition. And then realistic means it's something that we can share with the community that they'll agree on and say it really reflects our community, it reflects our resources. Yes, we have the resources that will allow us to achieve a 10% decrease in underage drinking. We have the resources and the readiness and the capacity to achieve these. So the realistic is really getting that community involvement. And time bound is, we talked about this, is this going to be a change that we can see in the short term? So that's like 6 to 24 months. In the intermediate term, 1 to 3 years, or the long term, 2 to 10 years. So it's really looking about being clear when we can expect to see those changes. Let's walk through, and if there are any questions or people want to add to that, you can. And then we'll walk through some examples. So again, when we write these specific objectives, there's lots of ways to write objectives. I'm not seeing anything in the chat box. One of the formats that we like to use is very simply, when we write an objective, we want to see an increase or a decrease in something by some percentage or some number from our baseline in some year to our target in some year, and then how we're going to measure it. Sounds like a lot, but it's not really. So just a good example of this is if we want to see if our objective is, we want to see an increased residents who like chocolate ice cream by 5%, from 55% of our residents who like chocolate ice cream in 2022 to 60% in 2024, as measured by residents reporting on the I Like Chocolate on our community ice cream survey. So looking at subjective, we can say what is going to change. And that's residents who like chocolate by how much? By 5%. From what? From 55 to 60%. By when? From 22% to 24. By when is from now, 2022, in 2 years to 2024. And we're going to measure it by using our ice cream survey. So different ways to write it, as long as we answer those questions, what will change, by how much, by when, and how we're going to measure it, we're able to write objectives. So let's look at some realistic objectives rather than looking at ice cream. And so again, It's all based on the data on our logic model. So for our logic model, we report that 17% of our high school students drank alcohol in the past 30 days. We can write an objective saying what we want that to change. And this is long term. We don't expect to see a change overnight in the 30-day use. There's a lot of factors in peeling back those layers of this ogre, this onion. There's a lot of factors that lead to the underage drinking. But we can see as an objective, we want to see a decrease in underage drinking in ABC County by 5% from 17% in 2021 and to 12%. That's a 5% decrease by 2028 as measured by 9th through 12th graders reporting they've used in the last 30 days on our ABCU survey. So again, all of these answer the questions: what will change? Underage drinking. By how much? By 5%. By when? By 2028. How we're going to measure it on the ABCU survey. So this is our long-term objectives. Again, the same thing, when we have good logic model, we can do our intermediate. These are 3 to 10 years, again, long-term objective are 3 to 10 years out. The intermediate objectives are roughly 1 to 4 years out. And so here we have availability. 49% of high school students say it's easy to get alcohol. Our objective might be decrease the perceived availability in ABC County by 10%, from 49 in 2021 to 39 in 2026, as measured by 9th and 12th graders reporting alcohol is easily available on the ABCU survey. So you can see there's a pattern here. What will change? Perceived availability of alcohol by how much? 10%. By when? By 2026. So again, our long-term was 2028. Our intermediate is 2026, and we're going to measure it using that ABCU survey. And then the short term, which is 6 months to 24 months for 1 to 2 years, is we can see 38% of our retailers failed compliance checks. So this is using non-survey data. And someone asked a question, well, how do we know whether we're making a change? We don't have to wait every 2 years or even every 1 year to do compliance checks. We can do compliance checks every 6 months. And so if we do compliance checks and we write an objective, we want to see a decrease in retail stores in ABC County selling to minors by 25%. From 38% in 21 failed compliance checks to 13% in 2024, as measured by failed compliance checks conducted by the ABC County Sheriff. So what will change? Failed compliance checks by how much? 13%. By when? 2024. That's 2 years from now, as measured by compliance checks by the Sheriff. So again, when we have good data on our logic model, whether it's survey data or other types, we can use that to write our objectives.
Dave, so this was such a huge shift for me when we first had like our first ahas around and about this. The fact that if we had all of the elements of our logic model together, i.e. if we had a good problem, if we knew what our intervening variables were, if we knew what our conditions were, and we had data associated with all of those, we already had all the information that we needed, just as you just mentioned, to write our objectives. And then secondly, because those things were aligned to time-specific or time-bound outcomes that we were looking for, we could write short-term, intermediate-term, and long-term objectives that really sets up our evaluation. It was just kind of, I remember us just having just a huge shift when we realized that this is something that would be a great benefit to coalitions that were setting up or trying to put together logic models.
And what's great is that when you talk about coalitions or providers doing this, a lot of the questions and challenges we heard from folks was, how do we get more participation in this? One way of doing this is to talk to folks. I'm going to go back to our long-term objectives. We can do interviews with people from the community, whether it's positional leaders, the mayor, the police chief, the city council, the school board, and informal leaders in the community, and with the PTA and with community groups, and ask them if right now our underage drinking is at 17%, what do you want to see that go down to? They'll have a discussion around that. Right now we know that the perceived availability is this. What do you want to see that go down to? What do you see retailers are selling to minors? What do you want to see the failed compliance checks rate? When people have an input, they'll have a discussion about it. We're engaging them in the process. They're more likely to want to be involved in the strategies as we put in place. And so the whole point of doing these objectives is funders may be asking for it, but it's also a great way to engage community members, because there's an old saying that around participation and ownership, and I know Dorothy knows this, people own what they create. And so if they're involved in this part of the planning, writing objectives, they're more likely to want to stay involved in developing the strategies.
Hey, Dave, also, and Dorothy, one of the things that I wanted to make sure that we were aware of that we can do, and want to make sure that our participants were aware of that we can do, is at a point we can bring everybody in. Kristen is working behind the scenes right now to make sure that everybody has the opportunity of unmuting themselves and coming on screen when we're ready to do that and bring everybody in the room, so that we might be able to engage you audibly with respect to some questions that you all may have, because Dave just went through a good bit of information right there. And so Dave and Dorothy, whenever you're ready for that, you can let us know and we can make that happen.
Yeah, I'm going to turn everybody into a panelist, you guys. So you're going to be a panelist so you can come on video, but I won't do it yet. I'll do it
That
soon.
means we can't talk secretly behind the screen. Okay, so please, as we go through this, if you have questions, again, we're trying to respond to the questions and challenges you've identified. We wrote a lot of those down. And again, I have in my notes here, participation, getting others on board. Just by engaging folks in this process of writing objectives is a great way, because if the community says that we want to see more than a 5% increase, we want to see that cut in half, well, that's going to take a lot of effort. So we're going to need the whole community involved in that big a change. If that's what the community wants, then great. Let the community be involved in developing strategies.
The
You
second,
know, oh, sorry, Carlton, just
go ahead,
one quick point. You know, there was another comment that really stood out to me about how long it takes to evaluate the impact of our work. And sometimes we can't even evaluate it till after the funding is over. But that's what I love about these short-term objectives and these intermediate objectives, is that we're able to, it's almost like our early sort of system, right? We can see in the short term, we may not see a significant population level reduction in underage drinking, but we can illustrate that we have seen a change in our short-term objectives and our intermediate objectives. So that's one of the other things I love about this model and this technique, is that we don't have to wait only for the long term to be able to evaluate whether or not we're starting to make a difference in our community.
And I think about that walking upstream metaphor is, if we fix the bridge, we're going to see fewer people falling into the river right away. We don't have to wait to count how many people make it downstream. So we can address those intervening variables and community conditions on a more timely basis.
Love it.
It's a great transition here to how the logic model demonstrates that. Again, in the long term, we look at our long-term objectives to say, ultimately, we want to see a decrease in underage drinking. The intermediate term, we want to see a decrease in that perception of availability, because we're going to be addressing multiple community conditions. Again, in the short term, one example we provided is retailers are selling to minors. But as we mentioned, there are multiple community conditions around availability. They maybe also be getting it from the frat houses in a college that's in our community, or from community events where alcohol is available. So again, when we understand those community conditions, as Dorothy said, we can identify those short-term changes we want to see that will ultimately lead in the long term to a decrease in the drug use. And again, just to point out that when we talk about different logic models, we would have a completely separate logic model for marijuana use. We would have a completely separate logic model for misuse of prescription drugs, because the availability of marijuana is different than the availability of alcohol. The availability of prescription drugs is different than the availability of prescription drugs. So again, that whatever drug we prioritize, we can develop a logic model that allows us to evaluate in the short, intermediate, and long term what we want to change, and then did we achieve those changes.
and Dave, the other thing that was really helpful for me was when we were able to discover and determine, you know what, writing objectives isn't really difficult, because there is an actual template to it. And when you took us through what that template was, that folks don't have to worry about kind of how they need to phrase or frame these objectives. That is a very simple formula, if you will, for writing each of these smart objectives, whether they're short term, intermediate term, or long term. So
when you've done that, and I love a good transition, then again, we're going to skip this. When you've done that, you can get to strategies and action plans. And here's where Dorothy's going to come and talk to us about how once we've identified these changes, then we can start to talk about what strategies we want to put in place. So that's the beauty of this logic model. It's all in one place. what we want to change on the logic model, the targets of change, what we want to achieve, the SMART objectives, then we can identify strategies.
You know what I love about this logic model is I think often some groups jump to the strategies without really looking at the data and thinking about what outcomes they want, but it's the strategies that get put first.
Right, right. And again, we have to know what it is that is happening in our community. What is that community environment that's leading to the ultimate problem, which is the drug use? So I'm trying to get my computer. If you can stop my sharing, if you will, so Dorothy can share her screen. There we go.
Awesome. So great. We have built the logic model piece. We have then mapped our strategies or mapped our objectives so we know what our target of change is, what do we want to do. And now is where we get to the fun part, where we actually figure out, okay, now that we've identified and we've named the problem, we've seen what it looks like in our community and mapped it up with data, how do we then develop our strategies and our action plans, which is really that middle section of this beautiful logic model from North Carolina that we love. So when we're starting to think about strategies, there's a few considerations. We want to make sure that from our SMART objectives, we're identifying who are the populations of focus. Are we doing strategies that are evidence-based? And we'll briefly touch on that. And we also want to make sure that we're doing comprehensive strategies, so enough dosage to actually change that community condition, because there is no silver bullet. There's not one strategy that's going to change that community condition. And then while we have it last, it's really a lens that we look through as the whole process is we want to make sure that we're looking through the lens of health equity. And once we've identified those strategies, then we can move into turning that into that mobilization piece of our coalition and our community, which is the action planning. So that's all based on those SMART objectives. So another really important piece to understand, and Dave mentioned this or Carlton mentioned this earlier, that some funders just ask us to stop at that intervening variable. Well, if we just stop at that intervening variable and we're talking about just availability of alcohol, then we don't know specifically what those strategies are that are going to match what's really happening in our community. So when we're thinking about mapping strategies, we want to map strategies to that community condition. And we want to identify who are those populations of focus. Now, in this community condition, we see that retailers are selling to minors. So I see two specific populations of focus. First of all, we want to address some strategies. We want to look at the local alcohol retailers. We want to understand why there may be low rates of compliance. Well, maybe they've got a lot of staff turnover and they just don't have the resources or the time to actually keep training those staff members because they're just turning over so much. And you know what? Maybe it's really hard to find good, responsible beverage server training either online or in the community. Or maybe law enforcement hasn't really been doing alcohol age compliance checks, or there's really no consequences. So there's really no incentive for those retailers to really train those staff because there's really not any consequences to selling to minors. We want to identify what those targets of change are and the whys behind what is leading to that community condition. We also maybe want to look at law enforcement. Now, because there's low rates of compliance, let me tell you, it doesn't mean that law enforcement necessarily doesn't care about it. Maybe they do. Maybe they don't have enough staff. I see there's some folks from Wisconsin. There's also a lot of rural folks. I've had more than many conversations with the law enforcement saying, Dorothy, I'd love to do alcohol age compliance checks. I've got 2 deputies on in the run of a day in my entire county. Tell me where I'm going to get the staff to do compliance checks. Maybe they've got limited staff. Maybe it is a low priority for them, or maybe they just don't have a training available for their law enforcement officers to understand and really be good at how to do evidence-based effective compliance checks. So we want to look at those populations of focus, and we want to sort of continue to peel back the layers to identify what's really happening to this in these targets of focus, so that we want to change those local conditions. We don't want to know why, so that we can align the right strategies.
And Dorothy, I love this part because each local condition is going to have, each community condition is going to have its own targets of change, if you will, the populations. If you notice, youth wasn't even involved in this because it's part of the environment that youth are living in, where they can go to a liquor store. If, say, the community condition is youth are sharing prescription drugs at school, then it's going to be the school, it's going to be youth, it's going to be the coaches, it's going to be the doctors. So again, that community condition and understanding that really tells us who our populations of focus are, that we're going to 2 things. 1, develop strategies around, but also people talked about participation. Now we know we want to engage retailers in our planning. We want to engage law enforcement in our planning. When we know who the populations of focus are, we can reach out to them and engage them in the planning process. So they'll own the processes, the plans that we put in place.
Love it. Yes. We also want to make sure that what we've identified of strategies to do is strategies are going to be something that works. Now, we often hear the term evidence-based practice or evidence-based strategies. Here's just a reference to a great resource from SAMHSA. There are other registries that identify effective approaches that have been documented by evidence and science. And so we want to make sure that we are identifying those strategies that have been proven to be effective. Again, this is one resource. There are other resources out there. Centers for Disease Control has registries. There's all sorts of different registries out there and guidance documents that are going to lead us to making sure that what we're doing is actually got a strong evidence base to it. And the idea here, though, is, and I'm going to go back to, there is no one strategy that is going to, in this example, stop the retailers from selling to minors. There's going to take more than one strategy. And we want to make sure that we're looking at individual strategies that are targeting individual knowledge, attitudes, and behaviors. We also want to change the environment. That's the community. We want to make sure that we're looking at individual strategies and environmental strategies. And I just need to say here, it's not an either or, it's an and. We don't just want to do a policy change. We also want to build skills of the individuals. We don't just want to focus on education because we also need that policy change. So as we're building our strategies, we want to make sure that we have individual and environmental strategies, which is going to give us enough dosage to actually change that local condition.
And Dorothy, I just love to use the example of this is in terms of looking at cars and driving and speeding. We all know, we all drive cars. We all typically know the speed limit on a street that we're driving down or on a highway that we're driving down. There's signs posted. So we can provide individuals with all the information we need. Here's information on what the speed limit is, even on your apps on your phone now, the maps that shows the speed limit of where you're driving. We can provide information for people to put their foot from the accelerator to the brake to slow down. They know how to abide by the speed limit, but they still speed. I know none of us on this session ever speed, but we do that. It takes also environmental strategies to change our driving. There may be speed bumps on the road. There may be law enforcement, either they're radar enforced or it's automatic taking snapshots and other things. And there are consequences to our speeding if we get caught. There are fines, impact on our insurance. The whole point of this is to stop speeding in an area. We need both individual strategies so people have the knowledge and the skills to do what we want. Also, we need to change that environment that also changes the behavior as well.
Dave, that's a particularly important example that you just shared, given the fact that I've got a daughter who's going to get her driver's license in less than 2 weeks. Let me tell you, I've been having lots of conversations about, you might get caught if you speed. But yes, we want to do both because you know what? Education doesn't always change behavior. I'm going to say that twice because you know what? Education doesn't always change behavior. It sort of tills the soil. It's an ingredient in the recipe, but it's not going to bake the cake. We also need to have those environmental strategies as well. So love it. Some examples of individual focused strategies that may happen in schools would be like programs like life skills training or the good behavior game. We also see that there are individual focused strategies that may be in existence in our community that are targeting the family, such as a Strengthening Families program. And then we also see examples of where we're building resilience and protective factors through something like a Big Brothers or Big Sisters program or a great after school program, or that would be a community level initiative that is, or setting that is also working on building resilience and individual strategies. So we want to have those individuals focused strategies, but we want to make sure that we've got those environmental strategies as well. And really, this is the unique role of a coalition. This is where a coalition really is, gets its traction for being effective, is helping by look at these environmental strategies. So examples of environmental strategies are restricting alcohol at community events, which is challenging those community norms where alcohol is readily available at every event in the community. It's requiring a permit for alcohol at community events. In Wisconsin, for example, I know that we've got this tendency, there's a new trend to do wine walks where we actually get rid of all alcohol licensing on a Saturday afternoon, and people can walk up and down Main Street and get alcohol at all of the different retailers. The coalition is working on restricting that wine walk initiative because it's where we need to actually look at policies that are going to limit, not increase access to alcohol. Environmental strategies can also happen in schools. So thinking about schools enforcing policies. And this is a really important point, Carlton and Dave, because we don't always need to pass a new policy in order to do environmental strategies.
Yeah.
Sometimes there already is a law on the books, but it's not being enforced. And so we want to actually look at how do we support the schools to enforce their policies on tobacco or vaping use. It also could be take back programs, and also could be some awareness campaigns. And we put an asterisk there because that's really, if you've got funding, a question for your funder. Some funders consider awareness campaigns and poster campaigns to be individual strategies, while others consider them to be social marketing or social norming campaigns or environmental strategies. So that those kinds of campaigns can particularly be fit into both boxes depending on the perspective and or the funder.
And what's exciting is, again, Carlton and I started this many years ago. When we started, there were maybe 3 or 4 evidence-based environmental strategies. Now there are literally hundreds that address specific drugs. And so it shows all the more reason why we need to have good logic models, because when we start selecting strategies, we need to know what it is we're trying to change and what's the best set of strategies to address that particular community condition. That's why that understanding that community condition and who the populations of focus are is so critical to developing strategies.
Absolutely. I think of a story, Dave. I know you've heard me tell this many times, that when I first moved to Wisconsin in 2006, a neighboring community had just successfully implemented a keg registration law to address binge drinking. And I decided that that would be a great law for our ordinance for us to work on, until the local police chief told me, Dorothy, great ordinance. Nobody in our community actually sells kegs. We don't need it. So even though there's a great policy approach, we want to make sure that it's matching what's happening in our community, because Dave, when you've seen one community,
I'll bet you've only seen one community.
you've only seen one community.
They're here all day, folks.
So let's take a look at what this could look like. So here's that community condition that we mapped to our logic model. And so in this community condition, we see that local retailer stores are selling to minors without checking ID. So our data has told us that. We've put it on our logic model. We know we've got some smart objectives. We want to change that. What are the strategies that might work? Well, you know what? We could provide information to store managers on the consequences of selling to a minor. We also might help be able to provide those training classes to clerks on the civil liability of selling alcohol to minors, because maybe the retailers just don't have the bandwidth to do it. We also might be able to provide point of sale materials to retailers, and we may work with our local governmental body, whether it be the city council or the council board, to increase the fines for compliance checks. We might also utilize point of sale software at checkout and to check IDs, and we also might conduct responsible beverage server training on site for retailers, which actually makes it easier for them to provide training to their staff because it's coming on site. We also might want to change the consequences by instituting tiered sanctions for non-compliant retailers that seem to be violating those compliance checks over and over and over again, giving them a bigger disincentive each time that they're not in compliance. We also might want to change the physical design by actually doing some WeID cards that are going to be on storefronts. We could do all sorts of education and awareness and changing the physical design with the WeID cards. And we may pass a local ordinance mandating responsible beverage server training. So you can see here that we've got providing information, enhancing skills, and enhancing services and support. Those are all really individual focused strategies. But when we see about modifying access and barriers, changing the consequences, the physical design, and policies, those are all really changing the environment or the shared community environment. So we see here that we've got a mix of both individual and environmental strategies. And if we're successful, this is going to give us enough dosage to change that community condition that retail stores are selling to minors without checking IDs. So this is an example of comprehensive strategies. Let's take a look at another one. And so I would invite you in the chat box, if your community condition, and a lot of you identified that vaping was a problem in your community, what would be some strategies that you could do in your community to address the fact, to change the community condition that youth are vaping nicotine at the middle school? So just in the chat box, what would be some strategies that you could use to change the community condition that youth are vaping at middle school?
And we're going to look into see whether they're individual or environmental, because we know we need both.
We could do vape detectors in the bathroom, social norms and media campaign. So social norms and media would be an individual strategy. Educating the school staff would be an individual strategy. Putting those vape detectors in, that's going to be an environmental strategy. That's actually going to be changing the school environment by putting those vape detectors in. Education. So again, education is going to be an individual strategy. We're going to probably educate the teachers what to look for, educate the youth on dangers. I missed that last one. Hidden. Dave, can you read that one? I can't see the
Hidden mischief for parents to teachers, and teachers.
So I see lots of skills development there. I also saw one about working with alcohol, with the outlet density. So we're going to reduce availability. We want to increase the perception of harm. How are we going to, we're going to start educating parents. I see lots of individual strategies. Can we think of some environmental strategies? Because remember, we want to have a nice mix of both. So lots of education, lots of skills development. We also want to look at things like moving vapes behind the counter. Rebecca, that's really important. And that's probably absolutely going to help change a community condition if youth are able to get the vapes at retailers. So that would be a different community condition. It's a really important strategy, and it's going to definitely impact this community condition at the schools. So thinking about what would be the strategies, those environmental strategies that would help change the community condition of youth or vaping nicotine at school.
I love that comment, though, because it points out there are multiple to address vaping. There are multiple community conditions. One is, let's address it at the school in that environment. Let's also address the retailer environment, because these are middle school students. I don't know if they're walking up to a retail store and getting it. Someone may be buying it. I would want to find out where the middle school students are getting the vaping and address that as a separate community condition.
And, I think that's also a really, really important point, because we're given an example of a one community condition. There's never just one community condition that is impacting the problem that you're working to address. And so you've identified some really effective environmental strategies for reducing retail availability of vape. Other environmental strategies that might happen at the middle school. So the vape detector would be a great one. I served 6 years on a school board, so I chaired the policy committee. I always think about policies. I would work with the school board to see if we've got a policy that is ensuring that we've got vape detectors installed in the classroom. Maybe we also want to make sure that we've got a policy in place that any youth that get caught vaping are going to be mandated to go into a diversion program. We're going to staff bathrooms. We may have the staff monitor the bathrooms, and we may put signage on the outside of the bathroom saying staff will be monitoring or bathrooms will be monitored. So we're changing the physical design, but we're also changing the environment by making sure that there's staff that are going to be monitoring the bathrooms on a regular basis. And so we've identified a lot of both individual and environmental strategies. I love this. Install a vape collection box. Love it. That's changing the physical design. That's fantastic. Carlton.
I wanted to thank Ashley for further describing Hidden Mischief. That's an excellent program. We know it well, where they teach parents and teachers about how vapes are easily hidden and the like. And so excellent example. Thank you for further explaining that.
Thank you. Excellent.
If I could jump in, one other policy example, we all have a lot to share here, is, and you mentioned it briefly, but budget. Is there budget for the signs? Is there budget for the vape detectors? If it's in the budget every year, then again, it's going to be continued. If it's written in, that's part of policy. So budget is related to policy as well.
So great contributions, everyone. The idea here is that we want to make sure that we've got enough strategies. We're not just going to be able to install vape detectors and that's going to solve the problem. We want to make sure that we're also educating parents. We're also educating youth. We're educating the staff. We are also looking at other community conditions like where youth are getting it. We want to make sure that we're doing enough strategies so that we're actually going to change that community condition. And it's also important for us to come back to the river story and to identify who is downstream. So we want to fix the bridge so we prevent folks from falling into the river to begin with. But we also want to look at who's in the river, who is already being impacted by this issue, because we want to make sure that we're identifying those folks that are being impacted at higher rates or at different rates than other populations. And really what that is looking at health equity. And we want to make sure that we are, first of all, back when we're doing our community assessment, we want to also identify those populations that are being impacted. We want to look at those risk factors. We want to look at those disparities that exist in the community that are impacting the folks that are using the substance or engaging in the problem. And we also want to engage that population of focus in the strategy development process. So nothing about us without us. So using that example that we just talked about with youth vaping in schools, for example, we don't want to develop those strategies without engaging those key stakeholders, the youth, the schools. We want to make sure that we're engaging populations of focus as we're developing our strategies. We also, when we are thinking through the lens of equity, we want to make sure that when we're developing strategies that we're not doing more harm, that we're not increasing the disparities that already exist. We don't want any unintended consequences of underserved populations that may be impacted by the strategies as we develop them. So when we think about the retailers, for example, in that in that community condition that we talked about with the retailers selling to minors, one of the strategies that we identified was graduated fines. Well, think about that. Maybe some of the retailers are big chains and they don't mind paying those graduated fines because they've got huge operating budgets. But think about maybe in our community, there's a small mom and pop shop and they're trying to do everything right and they can't keep up with the staff turnover and they're really trying. But you know what? We don't want to put them out of business by increasing the graduated fines. Maybe in that particular example, maybe we mandate training or we provide ways of actually changing that community condition without doing more harm, without putting that mom and pop shop out of business. That's an example of a disparity.
That's important because that may be the only store, whether it's in an urban community or a rural community, that people go to buy healthy foods. And if we close that down, we're going to change their access to healthy and appropriate food. So we want to look at all those consequences.
It underscores why it's important at every stage of our planning efforts, we make sure that we're thoughtful about including the voice of those that we are attempting to serve, making sure that they have an opportunity to ask questions, to push back even, to be able to challenge kind of what it is that we're thinking about, because it may very often force us to think about questions that we would not have thought of initially or originally.
I love it. There's a reference here to one of my favorite documents, so I just want to call it out. Is the Centers for Disease Control has a fantastic health equity guide that I recommend. I absolutely recommend looking at that guide because it gives tangible steps on how to think about equity in each step of our work, from assessment to capacity building to planning to implementation to evaluation.
I just put that link in the chat box.
So once we've identified those strategies that that are going to incorporate both those individual elements as well as those environmental elements, it helps us do action planning. And I'm not going to read this slide, but there's a couple of thoughts here that I just want to share about action planning. Is first of all, it shouldn't be an afterthought. It's the culmination of all of this work, from our assessment to prioritization, to logic modeling, to developing smart objectives, and then to aligning those strategies to match those community conditions. Then we want to make sure that we turn that into tangible actions. And once we've mapped the right strategies, then it's easier to do action planning. The other thing I'll say is sometimes people say, well, I'm not really quite sure what the role of the 12 sectors is in community work. Well, you know what the beauty is once we start mapping those strategies and we identify the targets of change and the populations of focus, it's easier for us to see what the role of each sector is in implementing those strategies. So with the schools and that, we know what the schools want to do. We know what law enforcement wants to do. We know how parents might be involved in changing those community conditions. And so, there's no shortcuts to action planning. It's the culmination of all of the other work that we did. It also helps us stay on task and on target and accountable not only to ourselves and our funders, but to our community and our coalition. And in the long run, it'll save time and energy and resources. And the other thing I'll say is it also keeps people engaged. I did strategic planning a couple of years ago. It was pre-pandemic. I was doing some strategic planning in person with a coalition. And at the end of the day, we were moving into action planning. At the end of the meeting, there were two ladies that came up to me and they said, Carlton, they said, thank you for this. We've been coming to this coalition meeting for 2 years and nobody's asked us to do anything. Now we have an idea of what it is that we want, that needs to be done. So action planning can really help plug people into what needs to be done.
And it also addresses, a lot of you had questions or challenges around funding. And it allows us to use the concept of braided funding, if you will, meaning if we have partners engaged, they can provide some of those resources. Or if your funding only allows you to do a certain type of strategy, you can look for other funding to develop different strategies or other resources in the community to do those other strategies, other sectors to engage in those specific actions using their resources. So it allows us to look at multiple funding, multiple resources in the community.
And then we want to turn it into an action plan. And I want to jump right over into, so now we know what the strategies are. We can think about, okay, if we're going to offer responsible beverage server training, for example, or we're going to educate the retailers on using point of sale ID checks or ID scanners, what are the steps? Well, we need to identify which scanners we're going to do. We need to identify how many sessions that we're going to offer. We need to identify who will be the trainers. We need to get them trained. It gives us the ability to bite those pieces off into little digestible pieces and turn them into actions, assign who is responsible, what those resources are. But the main box that I love over here, Dave, is the time frame. I've reviewed many, many grants over the years, and everything is the last day of the grant. It's September 30th, and I think to myself, wow, we're not going to start the work till the end of the process. If we do a really well-designed action plan, that time frame is going to help us drive the work. It's going to help us drive our meetings. It's going to help us stay accountable because we know what needs to be done by when to keep us moving forward. So this action planning piece is a really critical, important piece that's going to then drive our day-to-day work. So we also want to look at then if we're really successful in the strategies that we've identified. We had identified earlier 2 of our populations of focus. One, the local retailers that had low staff turnover, limited training, and there were minimal consequences. Law enforcement also had limited staff time. It really wasn't a priority, and they didn't have training available. But if we're successful, we're going to have trained staff. We're going to have less staff turnover, potentially. We're going to have increases in past compliance checks. We're going to have decreased liability, and we're going to address the loss of profitability because they're not going to be paying those fines for the failed compliance checks. On the law enforcement side, it's going to be a win-win. They're going to have trained personnel. There's going to be increased community support for enforcement because we as a coalition and a community supported and helped lift them up so that they could identify and implement those compliance checks. And we're going to have fewer youth alcohol-related incidents. So there's going to be less calls to service. It's going to lighten their load. So we're going to see that if we're really effective in our work, we're going to see the benefits to those populations of focus.
Dorothy, what I love about this logic model is it allows us to identify these benefits before we start implementation. And that's really going to build the buy-in of the local retailers. It's going to really improve the buy-in of law enforcement if we identify these benefits before we move into actual implementation.
So many reasons for us to love this logic model, right? Because we're naming the problem. We can see what it looks like. It's mapped up. It's mapped out with data. We have those smart objectives, so we know where our baseline is and what our target of change is. And now we know who our population of focus is. We know the right strategies, and we know who's going to benefit from these strategies. those strategies you'll see, and I that's one of the other reasons I love this logic model, is the way it actually gives a visual of where the strategies fit in context with identifying the problem and evaluating the problem. So we know that those strategies are going to be the right strategies. Ashley says, I love it too. You know what? This is a beautiful logic model. There's just so much to this that tells us who our population, what the benefits are going to be. Our evaluation plan is all lined up with it, and it's all data driven, and it's going to give us enough dosage to change those community conditions.
Dorothy, if I can just jump in here, and I'll say this simply, we've seen a lot of logic models. We've worked with logic models more than either of us want to admit how long we've been in this. We love this one because it's really, really thoughtful, and it's built upon a lot of the things that we've grown to see and learn over the years. Our hats off to Dr. Melinda Pankratz and everybody who was involved with thinking about this for the state of North Carolina, and it's benefiting a lot of other folks as well. But we're using this as an example because we really love the way this is laid out, and it provokes us with specific questions that really lead us to what I believe is a more effective logic model.
Yeah, that's a really, really good point. I just want to also say, you may have a logic model format that you love that works for you. Good. There is not one size fits all with logic models. So as long as you've got these elements and it's showing this sort of linear logic and it's giving you everything you need so that you can plan using data and that you can evaluate, and you've got that dosage of strategies, we love this one. But again, there's not one size fits all. You may have a logic model that you love, in which case, I'm just telling you, we'd love to see it. Dave, you were going to say something.
I was just going to say, if you have a good logic model and you have all these elements, whatever format a funder asks for, you can fill into their format when you have a complete logic model.
Love it. Yeah. So we just covered a lot of territory. I'm going to just ask either in the chat box or if we want to, how we want to do this, Carlton or Dave, which aspect of planning is most challenging? So may want to do this in the chat box, or is it the SMART objectives, the strategies, or equity, action planning, or other? Carlton.
Dorothy, if you want to just, we can, if you stop sharing your screen and Kristen, if you're there, if you've done the magic already, if you can inform everybody how to maybe come on screen and unmute themselves, we can go ahead and try to have a little bit of a conversation as we're kind of bringing this all into a head. So the question is, the question that you brought forward to us, Dorothy, if you can share that with me again, was about SMART objectives.
Well, it was about, so we've covered a lot today. Which part of planning is most challenging?
Face direction, or they're waiting to see, or they're waiting to.
It being an excuse for
Oh, we're gonna have to ask people to mute.
No, say, what did we change? Tell me what we changed.
Mm-hmm. What it? Yeah.
I know, Chris.
Sorry, hit my ankle. I don't think it's as bad as you're thinking.
Oh, boy.
It's gonna be.
We're gonna see.
That's technically Memorial's nonprofit.
So
Okay, I just muted everyone.
I put the question in the chat box. So what we had asked is, which aspect of planning is most challenging? Writing SMART objectives, identifying evidence-based strategies, developing comprehensive strategies, ensuring health equity is addressed, action planning, or anything else. Now is an opportunity. We'd love to hear from you.
I've muted everybody, but you can unmute yourselves.
So Lori Ann says writing SMART objectives. So I will, of course, turn it over to both Carlton and Dave for their thoughts, but I'm going to give you my thoughts first. One of the things about writing SMART objectives, I'm going to say, just use a template. Dave showed the template of those SMART objectives. I actually almost turn it into, like a word puzzle where you just have to use that template, so we can make sure that you've got the slides. I keep that right by me when I'm writing objectives or writing a grant so that I don't have to worry about what exactly is going to be the elements of those SMART objectives. Those fill in the blanks that Dave had on those slides can be a great way for you to actually use that as a template to write those SMART objectives. So literature reviews. So Rose, yes, I have also partaken in many literature reviews, but I'm going to say when it comes to finding evidence-based strategies, a lot of the work has been done for us. The Pacific Institute for Research and Evaluation, SAMHSA, the Substance Abuse Mental Health Services Administration, the Centers for Disease Control, there are all sorts of registries and documents out there that have done the heavy lifting so that we can identify those evidence-based strategies. And when you can't find anything in that, I'm going to say good old Google will often work to help you find effective evidence-based strategies. Anastasia says that developing comprehensive strategies can be a challenge, and you know what, it can. And I'll tell you one thing that we see very commonly is that people really tend towards education and awareness. And I just want to say, as you're reflecting on your own work and your own strategies, sort of think about individual and environmental strategies. And if most of the strategies that you've got are leaning towards education, I'm going to challenge you to say, okay, in addition to that education and awareness, how do we identify policies or environmental change that's going to underscore and help advance the impact of that education? Because it's not an either or, it's an and.
Teresa mentioned evaluation, but ripple mapping has made this less challenging.
And the point I would make about evaluation is when you have a good logic model, your evaluation is done for you. Because when you think about it, you have your objectives. And if you keep tracking that data to see if your objectives are changing, that's your outcome evaluation. When you've got good strategies and you've got good action plans, you track, did we implement what we said we were going to implement? That's your process evaluation. So again, the whole point about having a good logic model is it drives your evaluation in a way that you can measure your process and outcome evaluation.
Carlton, you're on mute.
Lorianne, I see that you came on camera. Is there a question or a comment that you have?
No, I'm all set. It's a great conversation, really helping.
Thank you. Rose, is there a conversation or I'm sorry, a comment or a question that you might have?
I was actually just about to type it, but what I was going to type is, by the way, hello, everybody.
Hey, Rose.
Hi, I'm so glad to be here. I was just thinking about the action planning part and how but I don't know if there's any way to address that. I think it's just built in the process when you're working with, various shareholders and you're working with, different community groups and you're looking at funding. I think that there's just like these embedded barriers that are that are built into the process. And I don't know if I think the action planning part and all of those barriers, because of the moving parts, can sometimes make that part of the process a little bit more challenging for me personally. If that makes any sense.
The way I would respond to that is, we've talked about this throughout this entire training, is if you involve people earlier on, they're more likely to see how their role, whether they're an individual organization in the process, and then more likely to provide their resources as part of the action plans. And again, people own what they create. If they were involved in planning and they help come up with the strategies, again, they're going to want to see those be successful and be more willing to put their resources on the line.
I agree with that completely. And I do think too that at least what I've experienced is, especially when you have these coalitions and these community orgs and these nonprofits and all these different entities that you're working with, I don't think collaboration is always comes easy. And I don't think it's like an individual choice. I think just on a societal level, on a systemic level, on a structural level, on an educational level, we aren't taught to collaborate well. And so I think people are learning now, and we're having conversations about building capacity and collaborating with others, and addressing the needs of the community first. But I just think it's a skill set that is still being developed over time, if that makes any sense.
And I love it, Rose. You just identified in the spiff. Again, it wasn't part of our agenda today, but that capacity piece is so important. We don't want to skip that. And capacity comes before planning, because we want to build. You're talking about readiness, you're talking about skills, you're talking about having the pieces in place to move into planning and implementation. That's why we don't want to skip that capacity piece as we walk through our strategic prevention framework.
Right.
Rose, I think you hit on so many wonderful points. And I think part of what it is that we're all talking about is that all of it is a muscle or a skill that has to be developed. Prevention for me is always more than a science, it's a craft. It's something that we work towards. It's something that we get better at. And you just identified that even collaboration is not merely something that happens simply because we think it's a great idea. It happens because there are certain elements that make it work well, and there are elements that make it not work so well. Those of us that are competent or consistent with thinking about this as a craft focus on how can we build collaboration in a thoughtful, intentional, healthy, and equitable way. So thank you so very much. We're right at time. And so what I want to do is I want to turn it over. I want to thank first and foremost my co-trainers, Dave and Dorothy. You did a remarkable job through all of the speed bumps that we hit throughout this. But thank you so much for leading a very, very thoughtful conversation for us all. We really appreciate it. Most of you stayed through the whole thing, so thank you all. And I'm going to turn the baton back over to Kristen and Taylor to take us out with last minute. I saw a lot of old friends that came on board for us. And so know that I love you all too, and sending you hugs. And thank you all so very, very much. Kristen, I'm turning it back over to you.
Absolutely. Dorothy, Dave, and Carlton, thank you so much. And Taylor, my collaborator, my teammate. Taylor's our newest member at the Southeast PTTC. So when you close out, remember, you're going to automatically go to an external site where you can complete our GIPRA evaluation. And then we did add a few extra questions that you can go to. Tomorrow, I think you'll get a thank you again, and it will include the link to the certificate of attendance. The slides will be PDF'd and available on our website. The recording of this will be available on our YouTube page. And a couple of you have asked about the template for the logic model. And I'm going to work with Dr. Pankratz to see if we can get that and put a link to that on our website. It'll be with the slides under resources. We have a whole section on our website about this workforce development series. It has information on session 2 and session 3. So make sure you register for those. And we appreciate your grace during the drama with the breakout. I tell you, WebEx is just my favorite.
Love WebEx. I love WebEx.
We're forced to use it, by the way. Otherwise, we'd switch to Zoom. And this is a commercial for Zoom. So I think that's it, everybody. It's the middle of the week. Finish the week strong. Remember to take care of yourselves and be safe out there. And we will see you in a few weeks.
Thank you so very, very much. Kristen, you got one question about how do we get the certificates again? Will it be emailed?
Oh, well, when you complete the evaluation, you will be able to download that. It's a PDF that downloads probably automatically, and you open it up, it'll be on the bottom of your screen maybe, and you customize it with your name. You'll also have another opportunity that will come to you, I think it's tomorrow, Taylor, in the thank you for attending email. You'll have a link to the evaluation and the certificate of attendance. So give it till tomorrow. If it doesn't work for you, email the Southeast at pttcnetwork.org and we will get you that certificate, because believe me, I know how important it is.
Dorothy, we love you. You've given up your vacation time. You're in Disney World. Go be with the children. See you later. Bye. Bye. Get off.
Bye, everyone. Thank you.
Dave Chevelle, thank you so much for your expertise and intellect, brother. I really appreciate our partnership, man. We'll talk to you soon.
I just put our email in the chat. Southeast at pttcnetwork.org is the direct email that comes to a number of us.